Welcome to the video huddle for Monday, April 6, 2020. Did you read your MyVUMC COVID edition today? If so, you saw the message from Dr. Wright Penson highlighting the bright spots of our efforts. 43 COVID-19 patients have been discharged to date, and 6 patients have improved and no longer need ventilators. Keep up the good work inside and outside the pharmacy. Some questions have come up on how to work through what to do if you're exposed to someone with COVID-19. The guidance on what to do if you were exposed to someone who tested positive for COVID-19 at work include contacting occupational health. You must self-monitor 14 days after the exposure date. You need to look for the onset of new respiratory symptoms, including loss of smell and a fever. If you have no symptoms, you can remain at work. If occupational health determines you are not wearing the right PPE, you will need to wear a mask. If you were exposed and have symptoms, stop. If you're at work, immediately remove yourself from the workplace, call your supervisor, and notify the occupational health clinic. You will be tested for COVID-19. You must remain on isolation while waiting for the test results. Testing is available at the Medical Center East second floor parking garage area, where Occupational Health Clinic has a tent set up for this purpose. Other testing sites can be located on the coronavirus website. If you test negative for COVID-19, if you no longer have symptoms, you may return to work. If you have a fever, please stay home until you have no fever for 24 hours without medications. If you only have respiratory symptoms, you can return to work but should wear a surgical mask until any respiratory symptoms have resolved. If you test positive for COVID-19, you will be contacted by a representative of occupational health. Your supervisor will not be given any specific medical information about you unless it is related to their own exposure. You must submit a first report of injury report through Veritas for the purposes of tracking for risk management. Notify your leader that you have been instructed to stay home and keep your leader informed as to when you may be able to return to work. You must self-isolate for a minimum of 7 days. After 7 days, you may return to work if you've had no fever for 72 hours without medications and your respiratory symptoms have improved. You do not need a note from a doctor to return to work. When you return to work, you need to wear a mask until respiratory symptoms have completely resolved and stay away from severely immunocompromised patients until 14 days after the symptom onset. What about if you have had possible exposure to someone you live with? You have the highest risk of exposure if you live with someone who tests positive for COVID-19. If you live with someone who has been tested but the results are pending, if you have no symptoms, you may continue to come to work but wear a mask at all times. Isolate yourself from the household contact until the test result is known. If the contact's test is positive, you must self-quarantine at home for 14 days from the last exposure as per CDC guidance, given the much higher risk of exposure. If the contact's test result is negative, you may continue to work with no restrictions. The full guidelines for COVID-19 exposure can be found on the coronavirus website under Clinical Guidance and Infection Prevention Guidance. Social distancing and hand hygiene are still our best defense against COVID-19. Thank you for continuing these practices inside and outside the pharmacy. A big thank you to Melissa Ashley, Eli Guadalupe, and the rest of the weekend team for enrolling 5 patients into COVID-19 investigational studies. Great work. The paperwork was perfect. Thank you. Thank you to Caleb Boyd, Emily Stevens, Prashane Bamarami, Ellen Thier, and Wayne Falk for learning more about the pharmacist role in the investigational drug service to be helpful in the time of COVID and increase understanding of the general processes within IDS. Thank you. If you find yourself in need of rolling over Flex PTO into the next year beyond the 40 hours you can roll into your sick bank, please work with your leader immediately to determine if this is possible. As a department, we are not currently in a place where we are canceling PTO. This is the intent of the additional 40-hour rollover into Flex PTO for the first quarter of fiscal year 21. We will review these requests on a case-by-case basis. As of now, due to lower census, PTO use is encouraged. The need to restrict PTO use will continue to be evaluated as the situation evolves. Thank you for your flexibility as we continue to navigate this HR update. This includes the video huddle for Monday, April 6th.